Hey YouTube, welcome to another video from SkinnyMedic. I want to tell you about a new term that's getting tossed around a good bit right now, and I'm really excited about it. The term is first care provider. So this term, first care provider, is getting tossed around a good bit by several committees at the federal level. I first heard about it from the TCCC committee, and now I was in a PHLS TECC class. God, that's a lot of acronyms, sorry. But it's a TCCC class basically for EMS, like Rescue Task Force stuff. We'll do some more videos on that. But this is a new term that's being talked about, and there's some class stuff being thrown around. But basically, it's you guys. Like, it's the people who watch my channel. And I was like, this is awesome. First care provider is basically someone who is trained, not even officially trained, to start providing care to these trauma patients in a mass shooting situation, a bus accident, whatever. There's mass chaos, there's mass trauma going on. You guys are there to provide care for us before we get there. If you've taken an American Heart class, you know about the chain of survival. Well, what they're figuring out is it's the same thing with these trauma patients, that if someone's bleeding out in the hallway of a church or the hallway of an office building, if you're at the mall, that the chain can't start when first responders get there, when police get there, or fire department or EMS. The care can't start at that point. The patient's already bled out. They've already bled out so much of their blood volume, they're in irreversible shock. So they're figuring out, pretty smart, is that bystander care needs to be the ones that initiate that chain of survival. That you're the one that needs to start the chains. That you're the one that's going to put direct pressure. You're going to stop the bleeding. You're going to put the patient in recovery position. And then when EMS, fire department, whoever gets on scene, that care continues up until they get surgery. So this is all, you're going to see this chain of survival like we've known for CPR. This chain of survival is going to come with this first care provider as far as trauma patients. You're also going to see now more like sidewalk CPR, which is, hopefully you have that in your city now. But you're going to see sidewalk stop the bleed campaign. You're going to see people learning how to do CPR. You're going to step over to another table and you're going to learn how to put a tourniquet on. You're going to learn what is massive bleeding, this blood squirting out. You know, people are going to be taught this. It's going to be a lot more public education push for tourniquets and things like that. In this PHLS class we were talking about, and that's where I get the statistic from, it said that 75 to 90% of trauma deaths occur before they reach the ED, the emergency department. So if you're going to die, you have a 75% to 90% chance of dying before you ever make it to the hospital. Well, we talk about things on this channel that are preventable deaths. Hemorrhage control, airway, respiratory, things that I do videos on is all about providing care before the first responders get there. That saying, you never know when you'll be the first responder, is exactly what this is going to do for this first care provider. So I'm really excited about my channel, what's going to happen, because people are going to start hopefully realizing that you never know when you're going to be the first responder. We talk about these mass shootings, we talk about the wrecks, the bus accidents, all of this stuff about trauma, and you guys know how to do it if you watch my videos. Tourniquets, chest seals, MPAs, positioning, like the recovery position. That's all this class is being taught. This first care provider is being taught how to do chest seals, how to make tourniquets, airway, and respiratory, and you move on. That's it. It's a real basic class. I'm like, sounds familiar what I'm doing. So hopefully you guys are going to start seeing this term more often. It's kind of similar to the Stop the Bleed campaign that was being pushed. But there's a lot of data coming out from these mass shootings that we're getting, post-op, things like that, that we're seeing that in the battlefield, a lot of preventable deaths are coming from extremities. That's where the tourniquets came from. You know, that's where all this was formed, was the military. But these guys are wearing ballistic helmets, they're wearing ballistic plates, so they have all of this protected. They have the computer and the pump and everything's protected. So it's the arms and legs that are hanging out. So that's where the tourniquets came from. Well, us civilians are not walking around with plate carriers on all the time. So now what they're seeing is, yes, that in these mass shootings, a lot of shootings are, these people are dying from chest trauma and gunshot wounds to the head. Now, obviously, gunshot wound to the head, you've got brain matter on the floor, you're dead. But chest, gunshot wounds to the chest, things like that, we can do chest seals. We've got chest seals in our trauma kits. We can make chest seals. I've done videos on that. MPA, I've showed you how to do that. Put someone in recovery position, showed you how to do that. So all of this can work. Obviously, tourniquets are, you guys like seeing those tourniquet videos, so those are on here. So everything this first care provider class is going to be taught is what you're seeing on this channel. It's what I'm offering in my classes as well. I just didn't call it first care provider. So I'm really excited to see what happens this year. So thank you guys for watching. You never know when you'll be the first responder in the right gear and the right training.